So, hello and welcome to this latest podcast from Staffordshire and Stoke-on-Trent CCGs. Today I'm joined by Dr Lorna Clarson. Hi Lorna.
Hi Richard.
And today our focus is going to be on the massive changes that have taken place in primary care throughout the COVID crisis. For anyone who's not absolutely certain what primary care is, we're talking GPs, we're talking about community pharmacy, your local dentist, that kind of thing. But today we're really going to be concentrating on GP surgeries. Lorna is a GP, but you're a bit more than GP, aren't you, Lorna? Do you want to give us a quick, brief history of Lorna Clarson?
So I'm a practicing GP at Brook Medical Centre in Stoke-on-Trent, but I've worked in and around different practices across northern Staffordshire for the last 10 years. I'm also the clinical chair of Stoke-on-Trent CCG, so it's my job to make sure that all the services that we buy on behalf of patients from the NHS are designed with patients in mind and are the quality that our patients can expect.
And I think just to add that CCGs are membership organisations and the membership is all of our GP practices.
That's absolutely right.
Massive changes caused across the NHS by coronavirus, but incredibly huge across primary care. Do you want to tell us very briefly how GPs were operating at the beginning of the year and how they're operating now?
So there's been a massive adaptation in the way that we work. So at the beginning of the year, about 80% of our consultations were face-to-face. So those were patients coming to the surgery to see GPs or practice nurses or other members of the team, pharmacists, physios, but actually sitting in the surgery in front of us and talking face-to-face. Obviously, because of the advent of coronavirus, COVID-19, we've had to think really carefully about that, because with every face-to-face contact there's an increased risk of transmission of the coronavirus from either staff to patients or patients to staff. So it was really, really clear that we had to change the way that we did things very early on. And we've done this by moving to a model where we do what we call remote consultations. So we're absolutely open for patients and their needs in terms of you can speak to your GP if you need them. They're at the end of a phone. But the majority of the consultations, we're trying not to bring patients into that risky environment. So we'll either speak to you on the telephone and deal with your problem in that way. Many surgeries are doing video consultations where they can see you via a digital device. But if we absolutely have to, we can bring you into the surgery for a face-to-face examination.
So before we go into any more detail about that, how long did you have to plan that?
We had to move to that model over the period of about 2 weeks. So it was a really, really rapid transformation. I think we absolutely recognised early on that where there's a change in health need, where there are, so for example, over winter where we have often have a flu outbreak, we know it hits primary care first. And we are really mindful that we need to adapt above and beyond what we see happening in the hospitals. And I suppose that's an advantage of general practice being the way it is, having lots of smaller practices who are all independent. It's much easier to make those adaptations in those individual units coordinated by the primary care team than it is trying to make a change in one great big massive organisation. So it means that general practices can be and have been in the past quite dynamic about the way that they respond. The other thing to say is that there's been a growing section of the general practitioner community and the patient community that have been asking for this for quite some time. Because as you can imagine, we live lots of our lives digitally, remotely these days, don't we?
Yeah.
And it doesn't always fit, particularly as the demand on general practice outstrips its supply at the best of times.
So technology like Skype isn't new, is it? And there's been more and more rollout of Skype consultations, but it's been at a fairly slow pace, hasn't it? But things have really had to ramp up.
Yeah, that's right. And this has just given us the, I guess, the motivation that we've needed. I think there have been lots of things that have held us back in terms of worry about elderly patients being able to use it and perhaps being disadvantaged, and people having access to smartphones, or, you know, patient confidentiality, all of those things. And actually, this has just forced us to find a way to make it work really quickly, and it's just removed all those excuses that we've had for not doing it thus far. So I think that there will be lots of positives that come out of the coronavirus and the way that we work, as well as obviously the very sad and tragic things that we've seen in terms of examples like the lives of GP colleagues and consultant colleagues being lost. But there will be good come out of it too, and I think this remote way of working will be one of them.
GP practices, it's not just GPs, is it? You've got GPs, you've got your nurses, you've got your admin support, you've got pharmacists. Who is actually sitting inside a GP practice at the moment?
So most GP practices are operating with their full staff working. Obviously, there will be patients within that. Obviously, there will be staff members within that who are affected by the coronavirus and are having to self-isolate for that reason, or who are having to self-isolate because a member of their family has got symptoms. So it's really important to remember that GPs and their staff are people who are vulnerable to this virus too. And to that end, the workforce has suffered the same challenge as the hospital workforce, as the delivery company workforces. You know, everybody's seeing this taking a toll on people who are available to provide services. But again, another advantage of the remote working is that where we've got GPs who are self-isolating at home because one of their family members is ill, but they aren't, they can keep working at home. We've managed to keep GPs working and linked into their patient records.
So how are GPs coping? Because it's a high stress occupation at the best of times, isn't it, being a GP? How are you coping with this cultural change that's really come almost like a flick of a switch?
Yeah, and I think it's important to recognise it isn't without challenges. I think there are lots of GPs who are really missing that face-to-face contact with patients. Although it is quite a high stress occupation and you can end up seeing lots of patients in a day, that is one of the things that lots of us really enjoy and value about our jobs. Talking to people on the telephone or over a digital link, it isn't quite the same. And in many cases, it actually makes the job a little bit more difficult. You know, you don't quite get the same non-verbal cues, the same intonation of the voice, or the small change in the body language that might give you a clue that something else is up. Or, you know, telephone consultations, you know, you can't physically see the person in front of you. So you have to be just that bit more thorough and sure that what you're saying is exactly the right thing. So it can take a bit longer. So there are some additional challenges with, and we're having to, you know, I think we're just having to find our feet with it a little bit and learn as we go along.
And typically, that small number of patients who are need to be seen face to face, who are they? Well, let's clear up who they're not for a start. They're not patients who are COVID symptomatic, are they?
Yeah, that's absolutely right. I think the majority of patients who get COVID-19 have a very mild illness. It's not pleasant, I won't fib, it's not a pleasant illness, but it is a mild illness, and it's the sort of thing that can be managed at home or with some support from NHS 111 or NHS 111 online, as they've got a team who are dedicated to doing just that.
Those patients who have got signs of COVID and do need to be seen face to face, usually because they've got complex underlying problems as well. We've got what are called hot clinics for those, haven't we?
That's absolutely right. So we've set up a series of clinics around Staffordshire and Stoke-on-Trent that are staffed and are specifically for those patients who have symptoms of coronavirus or who have potentially been exposed to it but need a face-to-face. So say there's somebody in their house who has coronavirus, they may not have symptoms, but clearly that potential exposure is there. If they need a face-to-face appointment, we're sending them to the hot hubs so that we make sure that those symptomatic patients aren't mixing with patients who haven't yet been exposed.
Okay, so what's that group of patients who are not got COVID symptoms, but who still need to be seen face to face?
The group of patients who haven't got COVID and haven't been exposed to COVID, who might need face to face, are quite diverse, to be honest. So there's some routine things that we should still be doing. For example, if you've got a baby that is due to have its immunisations and your family doesn't have symptoms of COVID and your baby's well, then we want to still be doing those in general practice. And because it's really important for the baby that they get the immunisations and they get them in a timely way. If
you take your baby to the GP surgery, will the staff be wearing PPE?
Yes, they will. Absolutely, they will, because we need to protect you and your baby from any risk of contracting anything from us. So absolutely, they will be wearing PPE. And whilst that looks a little bit scary, so it'll involve them wearing a mask across their nose and mouth, they'll be wearing gloves and they'll be wearing a plastic apron. They may also be wearing covering across their eyes. It might look a bit scary, but it's absolutely for your and their protection.
Yeah, absolutely. So how are patients coping with this new way of working? And how can patients help their GP surgery?
Most patients are being really, really understanding and just excellent. They know why we're doing what it is that we are, and the GPs and their staff are people who can be affected by COVID too. So the majority of patients there are frustrations in the system for them that we all acknowledge. So for example, because we're doing everything on the phone lines are much more likely to be busy. And so we're asking people to be really, really patient when perhaps they're not well, they're worried. And the majority of people are coping with this really well. The other thing that we're seeing patients do, which is a good thing and a bad thing, is we're seeing people self-managing their illnesses differently. So we're not getting necessarily the same contacts from patients that we were in the past. And I say that's a good thing and a bad thing, because people self-managing their minor illnesses with support from, say, 111 or their pharmacies is something we've been trying to encourage patients to do for quite some time. And where it's a minor illness or where it's just reassurance that you're seeking, that's absolutely appropriate.
Yeah.
I think the bit of it that we're worried about is that there will be people who either don't want to bother us because they think we're too busy, or who are frightened to come into a potential COVID environment, who have actually got symptoms that we would be worried about.
Yeah.
That might mean that they have serious illnesses or even cancers.
Yeah.
And I think an important message to get across to those people is, please do come and tell us. We are still open for you. We might manage the consultation in a slightly different way, but we absolutely want to hear from you.
Some GPs are now having to work from home. How does that work? I mean, they sound like there's some practical difficulties with that. You've already touched on sort of secure access to patient records, because that's an absolute fundamental, isn't it?
Yeah, that's absolutely right. So there is a very secure process that GPs have to go through to access patient records from home, and we've been absolutely rigorous with our IT services, making sure that in no way can that connection and that data be compromised. If that were the case, we absolutely couldn't have people doing it. But no, it's been it is absolutely secure.
So NHS IT hasn't got a reputation, fairly or unfairly, for being the most robust. Is it working okay?
It seems to be working okay now. I won't lie, there were definitely some teething problems initially, as there are likely to be with any rapid change, if you like. But I have to say that everyone, including the IT services, have worked incredibly hard and have pulled together to make this work, because we at the heart of all of it just want the patients to get the care that they need. And it was really, really important that we did it. And so people worked round the clock to get it done.
Okay. And another thing that occurs to me, Lorna, is that I'm working from home and I've set up Office on my dining room table, and my wife is working from home and she's in the room next door, and we can hear each other's conversations, and occasionally I chip into one of hers. How patient confidentiality is so important. How can we make sure that's maintained?
So we are really clear with all our GPs that when they are working from home, they need to be in a confined office space where they can close the door. Where possible, we have them working using headsets and microphones so that what the patient says cannot be heard outside of the hearing of the GP themselves. We have really clear guidance about, having a very separate workspace and home space. So there are lots of measures that we're putting it into place. Although I think, nothing works perfectly. So I think, we've all seen the television programme where somebody's doing a news report and they have a little toddler visitor creeping in the background.
Yeah.
Very occasionally things like that will happen. But I think in terms of accessing patient information, confidentiality point of view, we're really, really clear that absolutely has to be protected.
I want to touch on a couple of other things briefly. First of all, this is not a popularity contest, obviously, but there's been a lot of focus on hospitals. I've seen very little focus on GP surgeries. Do you think but most patients, the person they see is their GP, isn't there? Do you think GPs have become a bit of the forgotten story of this crisis?
I think that's right. I think because of the severity or the potential severity of the illness and the speed of this spread and the pictures that we were seeing from China and from Italy, there was this absolute fear that we wouldn't have the capacity to have the oxygenated beds and the ventilators that were needed to sustain life for patients. And let's face it, that's what we all worry about, isn't it? It's the life-sustaining treatments.
Yeah.
And I think that's where it went for the government, for the press, for everybody. And actually, in the background, general practice is there quietly saying, well, look, actually, that's only about 15% of patients. The majority of COVID patients will not have that severity of illness and won't need to go anywhere near a hospital, but they will need help somewhere. And whilst NHS 111 have done an absolutely sterling job, I think the other thing to remember is that lots of the clinicians who are working for NHS 111 are general practice or primary care advanced nurse practitioners, GPs themselves, community-based paramedics. So there's a lot, there's been a huge a contribution to the COVID healthcare effort from general practice and our primary care colleagues that, as you rightly say, hasn't been recognised and isn't on the radar.
Yeah, and I think the other thing I'd probably just like to touch on is that a lot of the focus has shifted just recently to care homes, but visiting patients in care homes is absolutely bread and butter work for a lot of GPs, isn't it? Along with community nurses and others.
Absolutely. I think primary care in its widest sense, the district nurses, the occupational therapists, the physiotherapists, GPs and their teams, tissue viability nursing, we deal with care homes and our patients who live in care homes day in, day out. Many practices serve more than one care home. And it's been just devastating to see the rate that this condition has gone through a number of care homes locally and the impact it can have once it does get in. So it's been really a massive part of the work that I've done with my CCG hat on, linking in with the local authorities, our infection control teams, and our GPs that service those care homes to try and work out how we best manage this together as a group and how we make sure that these patients get the best care and get the care that they need, because they might live in a care home, but we should really just think of that as their place of residence. It doesn't define them necessarily as a person, but define their care needs. It just says this is an environment in which they live and we need to give consideration to that. the difficulty is it's in proximity to a lot of other people, and as you say, has a lot of input going in and out through visitors and care staff and healthcare professionals. But you're absolutely right. It is something that we do day in, day out, and have needed to continue to do.
Now, you touched on this earlier. This will end at some stage, and there is talk now of locking in inverted commas some of the changes that have been made for the better, that have been forced on us, but could become the new normal. Do you think that'll be one of the positives that comes out of this?
Absolutely. I think we've had to make some changes that we've been wanting to make for quite some time, and we shouldn't let those slip back. So I think some of the ability to connect remotely, whether that's over the telephone or whether that's using a digital device, I think that's something that patients and many clinicians would welcome. It may be that we don't do, I think at the moment we're doing something like 90% of remote consultations. We may not continue to do 90% of consultations because, as I say, many colleagues are missing their face-to-face with their patients and patients with their GPs, I'm sure. But I think we absolutely need to keep hold of the fact that both in general practice and in secondary care, actually, we don't necessarily need to ask you to drive to a building, struggle to park, and then sit in a waiting room before we're able to consult with you. We could do it in a much more time efficient way for everybody. And the other thing that I hope will stay is people are thinking really hard about whether symptoms or their concern really does need a telephone call from the doctor, or whether actually there are other wider members of the team that can solve their problem.
Yeah. And
we're seeing people starting to engage with expert members of our teams that perhaps they wouldn't have agreed to before. So people are very wed to seeing their GP, but actually if you've got a question about your repeat prescription, then our pharmacist might be the best person for you to speak to.
Because what is a pharmacist? They're an expert in medicines, aren't they?
Absolutely. And as a response to this crisis, people have engaged with those professionals and seen that expertise in a different way. So I hope that kind of the way that we are using and people are starting to value and understand the work that our wider team do, I hope that will stick as well.
So I think that's just a really good opportunity to give a shout out for everybody in primary care, not just GPs, but reception staff, clerical staff, the other clinical staff.
And it isn't just health and care, it's those people who when the boiler breaks down in the surgery, the emergency plumber that comes along and fixes it for us, it absolutely is all of those key workers, and I think we can't say thank you enough.
Great. Thanks a lot for talking to me this afternoon, Lorna.
You're welcome. Nice to talk to you.